Materia Medica 360 degrees, welcome back everyone. The remedy of choice is Eel Serum. The discussion will be on Eel Serum. This remedy is derived from the sea. We know many remedies which come from the sea. We know sepia, we know murex, we know ambrogracia and so on and so forth. Eel Serum is a remedy which is often thought of in cases of renal failure, where generally lower triturations are used on repetition. Now, the main indication that makes us think of eel serum is acute anuria or oliguria, and along with that, albuminuria. Of course, there can be usually raised creatinine, but what is important is that in eel serum there is generally no edema. So without edema, raised creatinine, anuria, oliguria and albuminuria, think of eel serum. Now, besides the renal system, we can also think of eel serum in cases of heart ailments, where often it is complementary to plumbum. So whenever we are thinking of plumbum met, we might also complementarily use eel serum. Now, as we know, acute and subacute renal insufficiency cases can have some ailments from. So what are the ailments from that we might get? Ailments from fright, ailments from cold exposure, ailments from an acute infection, of course, or intoxication. And therefore, affections of heart and kidney requires remedy like eel serum. Now, generally it is seen that first the kidney is affected and then the heart, and there can failure after kidney affections. Another sea remedy we know is sepia, but sepia generally wants solitude. She is fond of solitude and there is aversion to company. In fact, her own children she would not want to be with, which is also a case with eel serum. These patients will display despair or hopelessness because of the extreme stress they have been into. So a lot of renal cases will have a long standing stress, mental stress. Often these patients will have a postponing attitude for issues of life. They are very sensitive to work and they are discontented about things going on in their life. You might find dreams of snakes and water. In fact, water snake you can see in patients of eel serum. They can have a jesting or sarcastic attitude or the way of talking, and of course another PQRS that must be remembered is the shifting kind of pains. Remember, hypertension with cardiac or renal pathology, think of eel serum. I hope it helps. Do subscribe the channel because these kind of daily revision of the keynotes help us as wonderful prescriptions in our practice. Thank you very much.